80% of the feeders in second trimester, this showed the resolution or improvement of the findings. The patient with persisting or worsening hydronephrosis in the third trimester have high rates of postnatal pathology. Fetal interventions. If antenatal ultrasound shows lower urinary tract obstruction, this is usually present in male fetus. The cause is posterior urethral valves, bilateral hydronephrosis, oligohydramnios, or dilated bladder. Then the intervention is required like vesicoamniotic shunting or in utero endoscopic ablation of valves, which is done. Now, how to postnatally evaluate and management? Usually advised at first week of life after the baby is born, ideally 72 hours of life. In neonates, suspected posterior urethral valves, hydronephrosis, oligohydramnios, severe bilateral hydronephrosis, ultrasound should be done at 24 to 48 hours as early as possible. Grading of postnatal hydronephrosis. How do you grade? It is depending on SFU. This is Society for Fetal Urology. Neonatal hydronephrosis is SFU more than or equal to grade 1 or renal APD more than or equal to 7 mm. If the APD, that is anterior posterior diameter, is less than 10 mm or SFU grade 1 to 2, it should be followed for sequential follow-up alone for resolution or progression. Like if there is more than grade 1 or APD more than 7 mm, then it is neonatal hydronephrosis, no doubt in that. If there is the ultrasound is more sensitive at 6 weeks, because usually due to dehydration and all, we can't find it properly in the starting days. At 6 weeks, it's more sensitive. All diagnosed newborns with antenatal hydronephrosis should get it done again at 4 to 6 weeks. Now, presence of 2 normal postnatal ultrasounds excludes the presence of renal disease. MCUG, this is micturating cystourethrogram in patients with SFU grade 3 to 4. This is more than mild, right? Mild, what we had? Mild was grade more than 1. Or APD diameter more than 10 mm, unilateral or bilateral hydronephrosis, then MCUG is recommended. In 24 to 72 hours of life, MCUG to be done for suspected lower uterine tract obstruction cases. Usually, MCUG is done in infants with antenatally detected hydronephrosis who develop UTI. Now, we'll go through the summary. If the patient comes to you, how do you describe? Like briefly, antenatal hydronephrosis, unilateral, bilateral severe, systemic malformation. If any soft signs are present, soft signs in the sense, oligohydramnios, thick wall, dilated bladder, large or small kidneys, oligohydramnios, again parenchymal thickening, if this is there. Unilateral, third trimester ultrasound is compulsory. Then next at 72 hours of life. Whereas bilateral severe, 4 to 6 weeks, antenatal ultrasound is compulsory along with the 72 hours of life. Then we have to get it done at 4 to 6 weeks. This is antenatal, right? 4 to 6 weeks antenatal ultrasound. Then postnatal as early as possible, 24 to 48 hours of life. If there is any soft signs present, you have to refer them to the subspecialized center. Now, postnatal ultrasound. So, this was antenatal, which we have seen. This is postnatal. Antenatal, what was that? 72 hours of life. First at third trimester, 4 to 6 weeks. Repeatedly you have to do. Then postnatal, 24 to 48 hours. Now, postnatal, if there is no hydronephrosis, postnatal we grade it as SFU, right? SFU, grade 0 and AP diameter less than 7 mm, then no intervention is required. Postnatal mild hydronephrosis, if present, ultrasound should be done at 3 to 6 months till resolution. Moderate to severe hydronephrosis, that is grade 3 to 4, APD diameter more than 10 mm, or mild hydronephrosis with ureteric dilation is present. First, what we have to do? MCUG, as we have seen earlier. Then if there is no vesicular-urethric reflex, then you have to go for diuretic renography. If there is no obstruction, you can repeat the ultrasound at 3 to 6 weeks. If there is any obstruction, you can go for surgery or monitor till resolution. If there is VUR, then antibiotic prophylaxis is required, that is cephalexin in the starting 3 months. Then you can go for cotrimoxazole and nitrofurantoin later. If there is lower urinary tract obstruction, then surgery is required. Thank you.